We are here because of documents which have been passed. Let me start with the first one, the policy. The policy is giving us one direction, that all the people of this county should access quality, affordable, high health care. That is very important. That is the drive of the policy. If you forget anything else, don't forget that the policy will require us as a county to provide to all residents of this county quality, affordable health care. Your Excellency, I know you did mathematics and some chemistry. And allow me 1 minute to synthesize some figures here. Ladies and gentlemen, we have been given here that persons screened for eye problems in Bomet is about 600,000 people. About 600,000 people. The entire population of Bomet is 1 million. What percentage is that? What percentage is that? That is 60%, which means this project, Vision Impact Project in Bomet, has done great. Already over 50% of the people have been screened. And Your Excellency, allow me to request that in the coming 1 year, if possible, and that's now why all our partners will not leave, because we have some unfinished business. We need to screen the 100% of them. We still have 40% to go. Who is agreeing with me that we must go for this 40%? And our chief guest, I want you to see those hands. It's a great indication that you lead us in making sure that this 40% that is remaining are screened. Secondly, out of the 6,000 screened, 120,000 of them were treated. What percentage of the screened people normally go for more treatment? These statistics, you do that figure, 120,000 over 600,000. It means in our population, we have a ratio, which the statistics is giving us here, which can make us plan better, because we have the figures. We know who we are targeting. At least 12% of 60,000 is around 20% or 25%. So it means in our population, we have approximately 25% of people who require health care from us. So we can easily go back to our budgets, we can easily go back to our annual development plan, knowing in mind that we have a figure which is reliable, because this is actually what we did. Finally, Your Excellency, I would like to thank the County Assembly led by our Speaker for the speed record time that they were able to pass the required documents. We are here because these documents were passed legally and through a process that is given in law. Finally, ladies and gentlemen, sustainability of the project that we are having here depends on how, as a county government, executive arm of government, will implement the part of those activities that belong to us. We are being oversighted by the Assembly, we are being supported by our development partners, but the goal, the success, depends on how we execute these plans. So I'm calling upon all the county government officials, especially from the executive arm, both in the hospital and outside the hospital. Let's take this work seriously. It's a multi-sectoral approach. Everyone is a member to this noble objective. So, Your Excellency, without me taking my time, I normally say that I grew up during the Nyayo era, and you still remember how the Nyayo era went. So, and let's go, Monja.
Professor Barchok, Your Excellency, Deputy Governor, Bomet County, Shadrach Lotich, the chief guest of today, Mbake, and all protocol of staff, our speaker, na wananchi wote. Good afternoon. Let me take this opportunity, Your Excellency, to short it because I'm seeing we are running short of time. First, let me thank our donors, our partners, for the work we have done for the 3 years. We are really very grateful. The CPM has shown the impact in our county because they went direct to the community and do the screening, which created a very big impact. Your Excellency, during the screening, we came to realize that we have a problem in Bomet. So let me thank the CPM for giving us to know that we have a problem. It's the same way the NI did, that we realized that we have a problem. In short, Your Excellency, because this today we are they are ending up their project, I want to say that we need you, the partners, than the way you need us. We have a problem and we still need you. So let us not make this to be the last, but let us continue making more engagement for our people in Bomet. Your Excellency, the policy, let me thank the Assembly. The Assembly, let me say thank you very much. The work you did even yesterday and for the few weeks, Queen Tuliona Matunda. I really thank the Assembly through the Speaker for the work done and my committee for the work done to make sure that we have the policy in place. Your Excellency, this is not the first policy that we are launching today. When there is an emergency in the eye, we have emergency and referral policy in place. So, by emergency, we have the emergency policy in place. When we also have the F5. So the CPM, we have sustainable of the project because we have the F5 that will make the finance available for the project. We also have the community health promoters policy. Those are the policies that we have managed in the Assembly. And the community health promoters policy have assisted us a lot in this program of CPM. We also have the nutrition and nutrition policy. That policy also is more of prevention of eye problem in our county. So we have the policy in place. That is the reason why I'm saying thank you, the Assembly, for the work you have done since we start this journey. We also have the policy now, which today we are launching, the eye policy. The four policies before the eye policy, all of them support the eye policy. So, Your Excellency, we expect the outcome in this policy. One of the outcomes that we are expecting is reducing in cases of prevention and also increasing the access eye services in our people. We are also expecting to improve the high healthcare awareness to our people. This policy has an impact in the county, and I want to thank the executive for making this policy to be in place, and the Assembly for passing the policy. I want also to thank the Assembly for giving the first time to make a budget line for the eye. And Your Excellency, the reason why we need to have the eye hospital to be interdependent is because so that they can have their own things, they can make their own requisition, they can use their money in FI, so that we cannot mix up and make the other one to be a department, a section in a head. We need to have it to all their issues, and also in terms of human resource, they have their way so that they can go to the schools and they just expand what we have. This Kenya people are running. Everything is in a speed. So when you left another department outside or a section in a department, itakaa huko nyuma. So we want to make it ikuje mbele kila mahali. That is why nutrition tumeweka iendelee, tumeweka tena mambo ya high iendelee, na hizo maugonjwa zingine. Your Excellency, Now you know we have a problem through our research of cancer, cancer problem, of which I know in your office and the assembly are pushing for that. We are now moving to see how we can manage cancer screening in our county. In county of Bomet, we are looking that every person access to treatment. That is why we are moving very fast to see all the diseases that are giving us problem in this county. In those few remarks, Your Excellency, I want to say to say we have Mheshimiwa who is representing person with disability is in our assembly, and he's also working very fast to make sure that your people with disability are represented well, Honorable Lily. So with these few remarks, I want to take this opportunity to show my committee first. Wakuja hapa mbele, my committee, health committee, niwaonyeshe tu alafu niite majority leader aongoze the other team na speaker. Committee on health, wafika hapa mbele. Committee and my secretariat, wafike. Committee on health, wafike tu ndio wajulikane. These are my committee, they are committee of 7. Mfika haraka kidogo. The secretariat wako hapo, wasimame mahali wako, waonekane. So, Your Excellency and the team from NI, we have the CPM and all the stakeholders. These are my committee. They can just say their names, and then I'll invite majority to welcome the rest of my colleagues. In my committee, I have a privilege also to have my boss in, the Deputy Speaker.
Okay, thank you. My name is Leonard Rotich, MCA representing KSO1, also Deputy Speaker of Bomet County Assembly and member of Health Committee. Thank you so much.
Good evening, good afternoon all. My name is Temnetit Catherine. I'm a member of the committee and also a vice chair. Thank you.
Good afternoon. My name is Roslyn Chepto, MCA representing Rongan Amanaret Ward, and a member of this committee.
Thank you. Good afternoon. I'm Mheshimiwa Mutai Peter, MCA representing Sibar Ward. Maybe Chair allow me to make one comment. Your Excellency, there's a requested by Dr. Yator on the issue of teachers in special schools. Maybe I humbly request you, Your Excellency, that you give him that appointment so that those few children, we saw them here, they are accorded adequate and enough learning resources and also teachers. We respect them and we love them. Thank you very much.
Thank you, honorable members. You can come as the majority leader is taking on.
Thank you very much, Chair, Your Excellency, the Governor, the Deputy Governor, all protocol observed. I want to say we are happy today as we grace this occasion of launching of the Bomet County Comprehensive Health Care. We are happy to have been associated in this program, and I want to say that we have traveled a long journey, and at least we have made it. Yesterday, we had to work all afternoon to ensure that we come up with the policy. And our happy members supported the same 100%. This one is something that we have tried, and I want to thank the Health Department and the Committee on Health that they have been able to come up with 4 policies. And this actually will bring about quality services in the Health Department. Your Excellency, we are grateful in what we have done together, and we are committed to doing everything possible to ensure that Health Department is given all what it requires in order to provide all what is required for our citizens. Otherwise, in front of you, because of time, are honorable members, whom I want to thank them very much for what they did yesterday. In fact, Your Excellency, before we even tabled the committee report, the first communicated from the Speaker was the invitation for us to attend this function. So at least as we were working on the same, we had already been given the invitation. So we made sure that we had joined this business in order to attend this very important function.
I will count from 10 downwards. Tukifika 1, utakata sasa. So we are starting 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And let's appreciate Asante Sana. We are launching it officially. We are launching the policy officially. All of them to the stage. Immediately after they sign, I will welcome them to the stage so that they will be given the copies